Okay, thank you all for coming back. I'm Jeff Feinman. This is Dr. Richard Pitcairn. We're both veterinarians. He is the father of veterinary homeopathy in the US, and I am a student and friend for many years. And we're going to talk a little bit today about what you can do with your pets to keep them healthy and free from problems such as susceptibility or sensitivity or increase their resistance to germs. So thank you so much, Dr. Pitcairn, for being with us today. Dr. Pitcairn is a world-renowned veterinarian and immunologist and wrote one of the first holistic care books for pets back in the 80s.
82 was the first edition.
That's wow! It's now in the 4th edition. I think the book has sold 500,000 copies since then.
Yes, it has.
Amazing. That's great. More and more people are getting more and more interested in these natural and healthy alternatives. So
yes, I think it has because another way of putting it is that the conventional, what we call conventional medicine, hasn't been completely successful. So people are looking for other ways to deal with things. Would you agree?
But we have conventional medicine doing amazing things for fractures and injuries and organ replacements. So what do you mean by it's not been successful in acute diseases or chronic?
In any kind of disease, in my opinion, of course, everybody will understand that I'm speaking now from a non-conventional viewpoint, because otherwise I would have stayed in that system of medicine. But I realized as the years went by, and not seeing the satisfactory results in my cases like I wanted to have, that the conventional system that we call the allopathic system is based on a philosophy, just like homeopathy is or any other system is. And that philosophy of the allopathic is that symptoms are a disease, something separate from the patient, and that we should then fight it. We should try to put it down in some way or kill it. So drugs are used and surgery is used. And what the problem is, as I understand it, is much of what's being attacked in that method is the healing mechanism of the body. So it weakens the person or the animal over time. They actually get weaker. Like steroids are the most extreme example. I mean, steroids shut down the immune system. Why would you ever use that, right? So, that's the problem in a nutshell.
And that kind of leads into your understanding of this vitality imbalance, or what it is that we should be doing to achieve balance in the world, achieve balance in our pets and ourselves. And is that even important?
Well, I think it comes down to that there is a state of optimal health, which is natural really to us. I mean, if we live lifestyles that maximized our health, in the sense that, by maximize, I don't mean to increase it above normal. I mean that if we start with normal being already really not very susceptible to anything because we're strong and healthy, that's the ideal. And the problem is, as we all know, is that our culture, our conditions of our culture, with all the things that are being done to the environment and to resources and the contamination, has gradually eroded that level of health. So now we become more susceptible to chronic diseases and infectious diseases both. And so, as far as medicine being effective, if you study the progress of medicine, you'll find that disease is increasing steadily rather than decreasing. And that's the treatment of serious problems is not really that successful, though they tell us it is. But it's not really when you look at the details.
So that's what you meant when you said that the conventional model, conventional medicine is not healing people, not helping as much as the model that we're talking about today.
Yes.
Just one of balance, which is, balance in
Well,
the,
I think uh, it's a adopted view. I mentioned here before I go on that most people know that the third leading cause of death is medical treatment. That's not good. And and also if it were really a very successful system, with each generation we've had less and less disease instead of the opposite. So yes, the problem is that there doesn't seem to be very much attention given to very obvious issues like that our air is becoming contaminated, that our food is contaminated, that our lifestyles are such that we don't get enough fresh air, sunshine, and exercise. We don't have enough um, emotionally positive interactions with people. There's just more conflict. And especially now with this epidemic, they've separated people. So now you live alone to a great extent, which is not healthy. So I think medicine has not, for whatever reason, has not taken that view of let's look at the overall question and why can't we promote maximum health for people to begin with. Does that make sense to you?
it does very much. Thank you. What action points? Do you have any specific action points using that knowledge he'd recommend the people do with their animals?
Well, there are many things, of course. I would say probably just to narrow it down to what we could look at would be um, the pollution of, like I said, the environment. You have an animal that say lives in a house or an apartment where there's a lot of chemicals being given off from the furniture, carpeting, paint, sprays, whatever's being done, cleaning agents, and no fresh air and no exposure to sunlight, and no exercise. That's certainly an important factor. I think probably there's also lifestyle. Dogs, for example, are animals that in nature travel huge distances every day and are very excited about seeing new things. So to be confined in a place and have very little movement is very boring. And I think if we extrapolate, it'd be like for you and I, if we were kept from doing anything interesting, whether it be reading, looking at our phones or our internet or anything, just had to sit there for days, we'd be so bored we wouldn't want to live anymore, right?
Yep.
So I think a lot of animals find themselves very bored. They don't have much interest in life.
So
And
men
then I
can
think a third factor, which is very important, is the quality of the food, which is what we've emphasized in our book, because food is very contaminated now with chemicals that undermine health, that cause cancer. There's pet food, most pet food that you buy is going to be, containing GMO and contain Roundup and contain all sorts of hundreds of chemicals. So those are important things to emphasize.
so avoiding all those things, mental stimulation and fresh food,
Mhm.
fresh
That's why,
clean food.
yeah, that's why in our book we emphasize that we introduced home recipes you could make of going out and buying fresh organic food and making your own if you wanted to, if you have the willingness and ability, then you're going to give them the very best quality diet. And I find a lot of people when they switch their animals over from commercial pet foods to a more fresh food diet, their animals clearly improve in appearance and activity.
Sounds great. And is there any relation between that and the susceptibility that you mentioned earlier? Do you think that what we feed affects the susceptibility
Sure.
or said you do?
Yeah, because our bodies are living entities. Everything that we do during our day, everything we experience during our day, the body has to deal with. So a simple example to start with would be to say, you walk into, you walk outside, let's say, and it's hard to relate to this time of year, but let's say you walk out and it's very cold, your body adjusts to that coldness by changing the circulation of the blood to the surface and warming up the interior and so on, right? It's very reactive and receptive to the situation. In the same way, when it's constantly encountering chemicals and substances that are toxic, it has to deal with them. So let's say, make it simple. Why don't we say that um, considering that the maximum ability that the body has to deal with, let's say, is 100%, and then if it's in a situation where every day it's dealing with dozens of different substances that it has to break down and detoxify and try to deal with, that the ability that's left to deal with other problems, such as a virus, is maybe 50%, because it's tied up in trying to deal with the constant barrage of things coming into it. Does that make sense to you?
It does make sense to me, and actually goes perfectly into what I was going to ask you next, which is whether you have any feelings about whether germs or bugs in general are more important than those factors that you described. In other words, if you're exposed to a bug, are you just going to automatically get sick, or is what we call the inner terrain, or the inner balance, is that more important than the germ, or are they equally
Oh yeah.
important, or?
The natural susceptibility is the most important by far. Germs are not very powerful, honestly. I know it sounds strange, but they're not very powerful at all in what they can do. They only affect those that are susceptible. If they're
How,
not susceptible, it can't do diddly squat.
uh, wait, so are you saying that if you get sick from a benign germ, say, something that can cause major harm, you're saying that that's not a function of the germ?
It's not a function of the germ to affect the healthy. Well, I mean, if you, in the sense that if you look at, say, what biologists have studied, the situation in nature, let's say, in animals that live in the wild, and they would get maybe exposed to something that we call a disease, a bacteria or virus or something. What they see is that the ones in the herd, let's say, that are affected are the ones that are old or weak, not the healthy. So you could translate that, if you would like, into saying the function of those diseases is to basically take out the weak and incapable of strong health. Does that make sense?
It does make sense, but I'm sorry, I guess I'm gonna have to ask this. Um, what about the seemingly healthy 30-year-old that gets sick? All of a sudden they get, a virus or bacteria.
How do you know that they're healthy? Well, see, what's our standard for health? Let's say the 30-year-old has been to, the history of that 30-year-old is to have had a number of health issues and treatments over the years. And now lives in a situation where they're exposed to, like, say, in China, where there's tremendous air pollution. Would we say that person is healthy? Just because at the very moment that they're exposed, they don't show any symptoms. That would be kind of simplistic, wouldn't it?
Yeah.
So I think that, it comes down to, we'd have to look more seriously at what the definition of health is. Because if they have a history of not being healthy and you have to keep getting treatments, as most of us do, in our generalizing, then you can't say we're really truly healthy to start with, unless
And
we've gone decades without ever needing a doctor, right?
and that actually is going to be my last question, because I don't want to tie up too much of your time. But do you think, therefore, because you just told us a scale, of 100% being, the most healthy and the least susceptible and the most resistant to disease versus the ones that aren't, do you think there's a relationship in there between the symptoms of the body, that symptoms that we see in our pets, and their level of health. In other words, that they're more or less resistant to their environment based on their symptoms. I don't know
Well,
if
if I
that.
understand your question, it's sort of like what's the relationship of intensity of symptoms to their health, right? Is that what you mean?
Well, we're just trying to define health. And if you have lots of symptoms throughout your life, is that indicative of health? In other words, that 30-year-old may be healthy at this moment, but he's had, ear problems.
No, yeah, I see. No, I'd say if an individual, human or animal, has had recurrent health issues, they're not healthy. Because
Even
that's not the way it is in nature. Animals in nature aren't sick frequently like that. Maybe at the very end of their life. But no, that's not normal. We take it as normal because it's so common, but it's not normal. Natural is to be healthy and resistant. And if I may extend that a little bit, it's important to know that the body has natural defenses, a series of what would I call them, barriers to infection. So like with a virus, if a virus gets into your body because somebody's coughing on you or whatever, or you pick it up from the environment, and the virus gets into your nose or mouth or whatever, if a person or an animal is very healthy, that virus is never going to go anywhere. It gets to the surface, like say the inside of the nose, or it gets into the stomach or whatever, and it will then try to get through the membranes of the body and wants to get in, if I can put it this way, the virus wants to get in to the bloodstream and go someplace where it can grow. But it can't get through if the person or the animal's healthy, because there's all these cells here, we call them macrophages, sitting on the other side, they're just waiting for them. And as soon as they come in, they gobble them up. And the virus can't get anywhere. So a healthy individual, even if they're exposed, doesn't develop any symptoms because they handle it.
Got it. Okay, so that was a really, really important point to end on, and that is that common symptoms are not normal symptoms just because they're
No,
common.
no.
So a lot of
And if the
things.
person gets symptoms, obvious symptom, that means that their immune function isn't very strong. It's
Okay,
compromised.
awesome. Oh, that's fantastic. Do you have anything else you want to share or say in a few minutes before I know you have to go?
No, I'm in no hurry. I think what we're talking about is an important thing to emphasize because, I mean, I know it sounds extreme to tell people this, but I think I'm being sincere when I say that to tell a client that if you take some pains with your animal to see that it has a healthy lifestyle in the sense we're talking about, it has good nutritious food, is not exposed to a lot of chemicals, it has a life that's interesting to it. Your animal, I wouldn't expect it to be sick, probably ever in its life. Unless maybe it's hit by a car running out chasing something, but there's no reason to expect it to be sick. I think that we expect sickness because that's been our experience, and that's our experience because we're not really that healthy anymore.
Since you said we have a few more minutes, I want to explore what you just said. What about I've done everything right. I've done, the animals that we treat where the pet parents say, and they have, fed a fresh food and they've tried to minimize vaccines and, but they still get a very, very serious disease. Any thoughts about, where that is coming from?
Well, if you have somebody that it appears to you in your evaluation of them that they have done the maximum care, like we're talking about, then I would look at factor. You mentioned vaccines. I know that I've seen that be an issue for a lot of animals that have been vaccinated when they're young will develop immune problems later, as I'm sure you know. So that can be something that's carried over. There also can be sometimes uh, some things having to do with their inheritance because of the way they're bred, you know, that they aren't, people select certain traits, not necessarily health, right? They select other appearances. So those can be factors to go into, you know, there are certain types and breeds that aren't as healthy for those reasons. But I still think that for the most part, you know, that the most that what a person can do to emphasize protection is what we're talking about, you know, especially and those factors that we've talked about. Those are what are within your province that you can control. And if there's something beyond that, then that's where you come to somebody like a homeopathic veterinarian, Dr. Feinman.
Well, thank you again so much. It's been extremely illuminating and a wonderful chat. And I'm sorry I forgot to say at the beginning that you're a PhD immunologist and you've studied epidemiology. So all of this taken from that perspective really helps put it all in context.
Sure.
So thank you, thank you, thank you again, my friend. I really
Yeah.
appreciate it.
No, you're quite welcome.
And we will talk again soon, I hope.
All right. Sounds
Thanks
good.
again. Thank you all for watching. Bye-bye.